Hi, I'm Dr. Robin Koslowitz, clinical psychologist, parenting educator, and post-traumatic parent. Welcome to the Post-Traumatic Parenting Podcast, where we learn to provide our children with a healthy childhood, even if ours was anything but. Or maybe we had a wonderful childhood, but recent events in our lives have left us reeling. Let's face it, after 2020, we're all post-traumatic parents now. Welcome.
Hi, everybody. Welcome to another exciting episode of Season 3 of the Post-Traumatic Parenting Podcast. I am so excited to introduce my next guest because she and I have been friends over social media, even though we've never met in person. I love the way she thinks about eating and feeding and food and just her whole approach to especially working with teenagers. I think that's when I first started following you. Working with teenagers who are dealing with eating disorders is so rational and mindful and welcoming and warm. I actually had the privilege of reviewing her future upcoming book and providing it with a blurb because I like it so much. So I'm going to let her introduce herself, but I can't wait for this. And I know a lot of you have asked to do an episode about these topics. So here we are.
Oh, awesome. Thank you. Right back at you. So honored to be here today. I mean, so much so that I was like, hey, are you okay that I have a black eye and smashed my face in and I still want to come on?
I was like, absolutely. We can talk about all forms of body acceptance.
Yes. And so introduction, let me just give kind of a brief one, which is hard. I've been in clinical practice about 19 years. My specialty has always been eating disorders and all the co-occurrings that go with them, because really I don't think people generally have an eating disorder and that's it. Or at least that's not been my experience very often, if ever. I run a parent support group. I am the lead author of a new book coming out through Bloomsbury Academic, which I cannot wait to come back on and talk about because I think it's going to help parents so much. I've run a parent support group for caregivers of people with eating disorders for many years, learned so much about what it's like and how traumatic it can be to experience your child going through something that could potentially be deadly, could be chronic, could be acute. It's just terrifying. And yet you guys are so often the key to change and healing and love. So I think we can just kind of leave it at there. I am super well trained. I've got multiple certifications. I've got an LBCC. I've got an MFT. I'm not the doctorate level. I'm going to be honest.
There's all sorts of, the fact is you're licensed, right? Which is.
I am licensed and I have thousands and thousands of hours of something I've always loved doing in the field is filling gaps. If I see a gap, I'm like, why has no one filled this? And I
just realized I never said your name. Say your name so people can Google you and find you.
It's Alli Lazzer. It's a super long last name, but for 2 L's, 2 T's, 2 Z's. Yeah. I'm on Instagram, but my website is liveyourfullstory.com because I figured out all these different things I've done, from a flash mob for body acceptance to the books. I have another book called Meaningful. All of it ties in with living your full story. And yes, of course, there's that double point of fullness. Full in your life, full in your heart, full in how you live.
Yeah. Yeah, and it's so true. I love both your books. I mean, the second one's not yet in the world, but the way yeah, I know it. I got to read it on a transatlantic flight. It was great. It kept me very busy. I love the compassion and the way you approach this whole topic, which gets very sticky and people end up talking around it and getting very uncomfortable. And, how do I talk to my kid about food and eating and nutrition? How do I relate to it myself? Right? It just becomes it's funny because it should be so simple, right? It should be math. And then it's not. It's never math. One of the first things new parents complain about is, how do I feed this kid? And it never, that worry never ends.
Yeah, and I want to bring in a couple things. The whole idea about eating being simple in Western society, where it's tied to health, it's tied to morality, it's tied to weight, it's tied to desirability, it's tied to so many things. And underneath them all, I find it to really be tied to a sense of safety, whether that's about health, whether it's about fitting in. And wrapping back to the intro, I also want to make sure to give credit. I did bring on a co-author to the new coming book because I thought a coach could add in lived experience and some nice examples. So I do want to make sure not to leave that out. And so this brings us to the idea of weight bias. And, this is hard for parents. And this is one of the things that led me to something I feel, which is self-acceptance, which is also part why I was like, hey, I passed out, I smashed my face in, and do you want to pause? Do you want me not to come on? Like, I'm fine. And you were so cool in that you were like, no, come on. I think it's a good bridge. Right. Because there is so much tied to looks, and even as parents, parents want to protect their kids. They want to protect them from ridicule. They want to protect them from disease. They want to protect them from all sorts of things. And so I know it often comes from such a good place. Yeah. And yet, our ideas about food and body, for some kids, it's great, it's fine, you can say whatever, and they don't have, it's like there's a metaphorical switch inside of some people about eating disorders. And we don't know exactly what turns on the metaphorical switch because all the risk, causal and risk research, basically, if I summarized it right now, it would be like, hey, there's thousands probably of things that might combine or singularly be powerful enough, but we don't know what necessarily is going to for sure push on the button. And we don't know who's born with the eating disorder vulnerability button. So when parents have these beautifully protective ideas about how to keep their kids safe, slimness, beauty, all those things, for some kids that can start to pile in. Not that it's not a cause, but the messaging can start to echo the messaging that happens if the eating disorder voice gets turned on.
Yeah, and I love that you're talking about safety, because I think there are a lot of parents who try to do something, like you said, out of good intentions because it made them feel more safe. I'm thinking about like conditions like almost orthorexia when it comes to how you feed your kids. I've seen a lot of that where like we're going to not serve them seed oils, and we're not going to do this, and we're not going to get them to develop a taste for sugar, and where you're right. What's underneath that, and very often that comes in the trauma world, is this desire to keep my child safe. And always when we're seeking safety, there's always an element of truth, a tiny element of truth, right? There's a tiny element of truth that like people who have good nutrition have better health outcomes later on in life, but then it becomes something else, right?
It's when it shifts into rigidity, terror. I think those are hot pink flags.
Yeah, I like that term. Yeah.
Orthorexia often starts out, and here's the hard thing about eating disorders. I mean, gosh, we could talk about this for hours and hours, because one of the harder things about eating disorders is it usually starts off in a valiant attempt for something. Let's say that the person's in college and they're just trying to feel better about themselves, less insecure, and so they go on a diet.
Right.
And suddenly it develops into an eating disorder. And the way that eating disorders develop, I've been recovered for a very long time. I can tell you that I had multiple diets. I was very young. When I got the eating disorder, I literally woke up one morning and was like, oh yeah, this is on. Meaning my rigidity was on. My terror was on about gaining weight and needing to lose weight and how to do it and what to do. And it was interesting because it wasn't my first diet. Right. So it's so fascinating about what can, if that button is inside of them, what can eventually turn it on. But then you don't really know that you have it. Like, I just thought I was doing great. People typically think that they're pursuing health. Yeah. They're getting tons of compliments along the way. People are like, oh my gosh, this is amazing. You're so disciplined. You exercise so much. All of this messaging comes in that you're doing these amazing things, when really you're trapped in this cycle of rigidity and terror and messaging about if I eat something like in orthorexia, if you eat something that maybe is a little bit processed, it's almost like eating a poisonous scorpion tail.
Right. And like when you add to that people who are pregnant or feeding toddlers, right, that's that added piece of like, oh, I just poisoned this baby. Like, I mean, this is my sacred trust. Like, and we're talking, they put the wrong, form of creamer into their coffee, right? They wanted milk, and the coffee shop put in creamer, and they took one sip and they realized, and it's like, oh, but it had soy in it, and like that could murder people, like it, and it gets very, I'm saying that a little sarcastically because I'm really not making fun of the patient. I'm making fun of that voice in their head that is like, oh my gosh, I just killed my baby, right?
But you're not even being sarcastic.
Yeah.
Because those fears are so real, and it can often be a true terror, and then you don't know that you've gotten ill. You just think that you're trying to do. Often people feel like they've failed at doing well at health, failed at dieting, failed at exercising. Here's another irony for parents out there and for anyone who's dealing with this. There is a biological binge. And the biological binge happens. So let's say last time I ate is 6 p.m. and I sleep and I get up, but I don't want to have breakfast because I don't have a big appetite. And you know what? I'm going to push. I'm going to have just a little lunch because I'm going to save it for dinner.
Right.
At that point, and everybody's bodies are different, but what's fascinating is that there comes a time in which the body doesn't like being underfed. And the body will actually push you to overeat or to eat in ways that jack up the pop of energy or whatever the body kind of, you feel like your willpower is jacked up, but really it's your body being like, dude, you have not fueled me all day. So I'm going to scream like a toddler right now and get you to eat.
Right. Right. Like you can't think of anything else. And then it becomes this like shame, self-punishment cycle. It's so interesting because as you're talking about it from your lived experience, it sounds like a lot of my patients with OCD, right? Where one day they always felt, let's say, anxious about, did they say something mean to someone else, let's say. And one morning, though, they wake up and there's a switch in their head. I say bad things and I will kill somebody with my bad thoughts. And it just happened overnight.
Yes. And there was a study a while ago that they did an fMRI, I believe it was, of anorexia versus OCD. And I was honestly, I was like, I'm pretty sure anorexia nervosa is OCD. I'm pretty sure it's just food focus. Nope, right. Brain's different.
Right. It's not the same. And that's the thing, right? We're both having that thought of like, wait, this sounds so the same. I wonder what they would do with orthorexia and OCD because sometimes they sound very alike. No, it must be precisely 7 bites. Like it sound, that like it's like like.
Here's the other funky thing about eating disorders. Even as we're talking about them, that was earlier in my career when I thought that. That was way before I realized how often. I wish we had just the eating disorder umbrella, and then people flow in and out of restriction to binging to orthorexia tendencies, which orthorexia is not even a real diagnosis at the moment in the DSM. Some people will go, and I think it's how it manifests, and this is where we do need, it's best sometimes to, if you can find a specialist, which is difficult, and anyone can say they're a specialist, but there's no criteria necessarily. So sadly, when parents are panicked, they still have to vet and ask questions. Yes. But OCD, I believe that sometimes it can be a food focused, but orthorexia is often, first of all, it can be anorexia without the quote unquote fat phobia, which is the phobia piece of that. Because again, that goes back to even just saying fat phobia is like there's one body that's better than another, and not necessarily, because people who are very thin can be very unhealthy.
Of course, right.
So the orthorexia can fall into anorexia. It can fall into other specified feeding or eating disorder at this point, because we don't have a tidy way of classifying it at the moment. But I feel like it usually goes in most cleanly to the anorexia without the drive for thinness, because that's one of the core criteria.
Right. And sometimes there are like flavors of things. I have this a lot in my practice with the children who come in where a child was recently referred to us for ARFID. That's what the pediatrician thought the kid had, but they actually had a vomiting phobia, right? So the pediatrician thought they had like, avoidant restrictive food intake disorder based on the extreme pickiness of their eating and the tantrums around eating and like the very few foods they would eat. So it sounded to a pediatrician who doesn't have that much time other than to say, oh my goodness, these weight markers are really low, this malnutrition is problematic, we're concerned, right? That's the job of the doctor. I think you need to see a therapist. Appropriate, totally appropriate. There's a condition called ARFID. I think your kid has it, right? Which the parent had never heard of because it's a relatively new disorder, which, by the way, ARFID is more of a feeding disorder than an eating disorder, at least the way I think of it. I don't think of it as an eating disorder, but I know there's like questions about that, and different people have different ways of thinking. But when I met the kid, this was a vomiting phobia. Any food with texture could make me vomit. And one time the kid vomited and choked on their own vomit and then just resolved to only eat foods with no texture. Yep. But then the texture got less and less. So it went from like I can drink milk to like I can only drink clear liquids, but not because of any eating disorder ideation, but because I might vomit. You want me to die? Like, and we're talking like a very small child, right?
Right, which actually could, if we look at the criteria, potentially could fit into ARFID also because of that fear and avoidance and narrowing of nutrition. And it's so, the diagnosis is far less important than what the goal for a full life is to me.
Right.
And then how do we
think the reason I made the differentiation it was important was we had to do a lot of exposures to vomit and make vomit fun and funny and understandable because we tried to go the ARFID route of like, let's stretch you slightly into other textures of foods and things. And that didn't go anywhere until I was like, oh, vomit. We got to take out the play slime. We got to make vomit. We got to talk about vomit and the germs of it and the grossness of it. And we got to, play hangman with vomit related words. Like we got to do all these fun things. And then, then like sort of that same ARFID protocol that we would do suddenly started working, right? So sometimes we need to know what the diagnosis is simply to be like, what's maintaining the fear? Yes. But then once we figure that out, the treatment isn't that different,
Isn't that cool? They found a diagnosis. You found a diagnosis that fit better, and that led to the fullness in their life. That led to the healing, and that's the piece. There's such nuances about this. And ARFID, historically, you're right. It was originally a feeding and eating disorder. Now, according to the research, it seems we've shifted it into an official eating disorder. But to me, it still feels, because it's newer, it still doesn't quite fit the same way. But I just wish we had like one umbrella and just could do like
None of my ARFID kids have ever had any body related like fears. I've never heard like I'm going to get fat. I've never heard anything along those lines. It's always about the texture of the food in my throat. Will I choke? Will it make me feel a certain way? Putting it in my mouth makes me nauseous. Chewing hurts me. Like it's always like very sensory related. Once in a blue moon, it's about parental control and like things that it really isn't ARFID. It's probably something else entirely, but they're coming in under that umbrella because the parent has an odd way of feeding their children that we have to undo a lot of parental thoughts about food and eating. But usually it's very sensory. I can't swallow this. It will be gross. It will feel yucky in my tummy, and my tummy will feel yucky all day, and it will hurt. And then my tummy will hurt, and that will be your fault, right? Like that's what you hear from a toddler. It's that kind of stuff.
Is so brilliant. Look at them, how they're trying to just feel safe and protected and not in discomfort.
Yeah, and we're like, my job in life is not to make you have a tummy ache. I do not want you having tummy aches. We need to figure out a way that your body can get the nutrients it needs without you getting tummy aches. Sound good? Right? And then we work on it that way, right?
Oh, you sound awesome as a kid therapist.
I love little kids. Little kids are fun. And, but the thing is, you can't be a kid therapist without working with parents. That's how my book came about. It was like most of the parents that came to me, speaking of like eating, the old Dr. Spock quote, I wonder how you feel about it, where it says like, it takes a knowledgeable parent to create their child's eating disorder. Do you ever hear that quote?
No, but I mean, that is, as you came into this kind of accidentally, I came into working with parents so much a little bit accidentally myself. So
this was a quote from Dr. Spock that my mom used to tell me, because my mom was like, my mom got married in the 50s. I was like a change of life baby. So she's much older than like my friends' moms. My mom was like a generation before her. So she had certain ideas. So Dr. Spock was like, that's who you read in the 50s, right? And in her, so she would say this, that the reason why she serves a wide variety of foods but doesn't like force people to eat is because of this thing that Dr. Spock wrote. And I felt like with a lot of my patients, whether it was about eating, whether it was about behavior, whether it was about parenting, a lot of times when a parent would come into my practice and be like, I really intended to do A in my parenting and this totally unexpected B happened. Yep. And I'd look at the parent and I'd be like, but you learned to do that somewhere, right? Like, that's not you. That's your trauma, right? I don't know. I intended to be a calm mother, and then I'm yelling all the time. I'm a dad. I said, I'm never going to spank my kids because my dad spanked me. I felt unloved. And then I just spanked my kid. He was like rude to me, and I just spanked him. Like, and every time it's like, but where'd you learn that, right? You learned that somewhere. So a mom will come in and have like, it's really scary when your kid's not eating and the pediatrician says, your kid is malnourished, right? That's terrifying. And then she'll have all these ideas and she'll be like, I know you said to do meal times this way and I did it wrong. And then I ended up yelling at him, or I was like, just take one more bite. Or I know you said not to do that. And then I did that. Or, or my aunt said something and then I didn't like intervene fast enough. And it's like, yeah, but you learned to not stand up to your aunt somewhere, right? Or like you were saying, a lack of safety, like some self-control valve inside of her is spinning faster and faster, trying to control it, but like, just eat the food, like, right? I get it. I really get it. But you learned to be that way somewhere.
Absolutely. I mean, it is amazing. Even, not to keep flipping it back to this, but even when which by the way, I do love that my green matches my cheek.
There's probably some Wicked line that we could say right now. It's too bad I'm not wearing pink.
Yes.
Right.
Okay. I love Wicked, love Wicked. And by the way, she's one of my neighbors. Every time I walk past her safety camera, I want to be like, with a broom. What I was going to say is, even with this, though, it's amazing how the brain, like, my brain constantly wants to go back and blame myself and start doing all these things to categorize. And it's so interesting, like that panic, that when something's not going right, the brain just kind of seems to jump there, just like you were talking about right there with that parent. Right. And so throughout my practice, I've really learned how much self-acceptance and accepting things, like every time my brain starts to do that, I pull into, wait, I accept that this happened. Now that I've accepted that this happened, I am so blessed. I am grateful that I didn't break any bones. I am grateful I didn't pop out my eye because I severely punctured this area up here. Like, so everything, and it's not like a creepy comparative, but it's so interesting how my brain starts to spin, and then I pull it back into acceptance. And that really has been something I've worked on for years. And I think in therapy, we work to change thoughts so quickly. And I found that the missing key is often that we need to first accept. This is so similar to your AIM that you've talked about. You have to, not have to, but I find that this works where, okay, so that parent's thought came about to start screaming. That parent's like, what was under, now we got to look at, okay, I accept that I just yelled. Yeah. Why did I yell? What's under it? Oh gosh, because I'm a caring parent. I'm terrified. Now that I recognize those things, I kind of like those about me. The darker side is, I probably just freaked my kid out. So where can I go from here now that I've accepted the whole picture?
Yeah. Yeah, and that, like, exactly, that's literally so much of writing the book was parents feeling, like I'm the worst parent in the world, right? I can't do those things. Like, when parenting like boils down to share your calm and share your joy, and I don't have calm or I don't have joy, it's going to be very hard to parent. And I just think it's like what you're saying about it just really does. And I was struck by that in the book, and I was struck by that in the way you communicate. So much does come down to safety and feeling unsafe and restoring a sense of safety. And you're right, like not always does someone develop an eating disorder thinking I'm trying to feel more safe, but that's very much what's under it often. Yeah.
And when people say it's about control, I have lost my cool in a few blogs about that.
Okay.
Because it's information that it's like this myth that spins around. And what's underneath control? Again, okay, so I accept that I'm a controlling person. Are you really truly a controlling person? Let's look at that. Okay, so why are you having these things that you need to take over and try to manage and oversee and make happen? Oh, right, because you're feeling what? Unsafe.
Right. And yeah, control helps restore a sense of safety. Not because you're controlling in the manipulative bad sense, but in the sense of sometimes you are the one in control, right? Like if I am driving a car, I'd better control it, right? If I am steering a family, I'd better have the control because something could go very wrong. How often does it happen that when you're a supervisor, like we both are, right, where a supervisee will come to you with like a big issue with a case, and then you sort of start separating into buckets. Okay, first of all, is everybody safe? First, did we establish this and this and this? Okay, second, we're going to do this, this, and this. Third, we're going to document, right? Like, and we're like helping them, like, and then it doesn't feel so chaotic, and you leave your office feeling like, oh, okay, right? Like,
Yep. You kind of sort out the safety, but it's the make meaning, I think. I fell in like with that piece of how you view things. It's how we make meaning of what we attempt. And earlier you were saying, like, when people say I'm the worst parent, I'm like, oh my gosh, you know what? That just tells me that you've probably tried a lot of things and you feel like you've run out of options.
Yeah.
That's all. We just need more options to experiment, gather your data, see if it works, because as much as therapy, I mean, it's not a guaranteed science. There's things that have been shown in research to overall work, and evidence base is always your first line, your front line. But like CBT, and I adore CBT in a lot of ways, but I really learned earlier on, I was like, how do I do this where I'm not basically telling people that they're thinking distortedly, that they're thinking wrong, that they're irrational?
Right.
Because to me, that's just piling on to their low self-esteem. And so I kind of got obsessed with like self-esteem. Oh, that's a person's opinion of themselves. Well, no wonder people can be almost delusionally jacked up in that they're like, I'm amazing. When you watch those television shows where people audition and they can't keep key. And they're like, I'm amazing. I'm like, what?
Yeah. Nailed this.
And then you've got these parents who are thinking they're the worst parents in the world. And yet there's bravery, there's resourcefulness, there's resilience, there's inability to let exhaustion stop them.
Yeah.
Like, how is that the worst? So it all kind of came together, and I've really changed my practice to look at the self-acceptance piece much more than self-esteem, even though most of the research is on we should have healthy self-esteem, and I understand in the purest definition. But in like what you're talking about through Amen, what I'm talking about through how do you accept it? Once you accept it, what does it say about you? That you care, that this, that. Okay, what does it say on the dark side? Now, let's look at your options. And I went through this a while ago. I finally stopped. You know how we think about something like imposter syndrome and we're like, oh my gosh, I can't tell people I have it. It's to be ashamed of. I'm going to push it away. It made it so powerful for years. And then I was like, wait, this is what makes me triple check things. This is what makes Robin let me on her podcast and trust me.
Right.
There's so many blessings from it. So I just started owning. Yeah, I got it.
Yep. Yeah. Even, I mean, we're from the generation of therapists where we're willing to talk, I'm willing to talk about my PTSD. You're willing to talk about your eating disorder recovery, right? These are things that wouldn't have happened. In the 80s, a therapist wouldn't be like, yeah, I struggled with this too. It would be just much more like, I'm in my ivory tower telling you how to parent or how to recover from your eating disorder or your panic attacks, or you know what I mean? You wouldn't have that I am flawed and yet I have some wisdom to share.
And when it comes to eating disorders, that's a really hard piece because parents get so scared. They want someone to tell them exactly what to do.
Yeah.
And that's kind of scary.
Yeah.
Unless it's medical life or death, that's kind of scary because you're right. There are still a lot of therapies that I don't think we've done a good job at educating the public on how many styles of therapy there are.
Yes. So true. So true.
People come in and they're like, it's taken me years to come back because I didn't want that nodding. I need you to talk. And I was like, in my head, I'm going, oh, I know what style. I don't want homework. I know what style. Oh, they were like, it made me feel like I had different personalities within me. Oh, I know what style.
Right.
But nobody ever really said, hey, if this doesn't fit, it's the primary one I work with. If this doesn't fit, there are so many more styles. Let's figure out what might feel more interesting to you.
Right. And as long as we educate people about what we're doing, right? Because we do have to say, you came in, you had a referral for like EMDR, let's say, eye movement desensitization and reprocessing. As I've met you, I really think the way you're talking and what you like out of therapy and what your goal is, sounds more like internal family systems would hit what you're looking for. Is it okay with you? I know your psychiatrist wanted EMDR and that's why he referred you here. Are you okay with exploring that? And either yes or no, right? Or that you wanted CBT, I think you need a little bit more of a depth-oriented approach. As long as people know what it is we are and aren't doing, because I think it's true, therapists will sometimes just on a dime make that switch. I've done that without like updating, right? Saying, hey, actually, I think this is a better approach because I just naturally fall into the other model, right? But I've learned, you're right, we have to educate people. Like, this is the model we're doing. This is the theory of pathology. This is the theory of change. This is why I think it works for you. And then we can start.
Yeah, and I think if we could, I want people to have takeaways from today. Therapy, going to a therapist as a family, going to a therapist as parents, going to a therapist or going to a coach, like anybody who's going to give support, guidance, advisement, it is your right, parents, to ask questions. Yeah. It is your right. This is like dating. I mean, I know that's kind of a creepy because we have such good boundaries about, dating and stuff, but it really is like, if you don't feel like you may eventually trust the person in the room with you, if you get a creepy sense, also you can verify licenses. I mean, there's all sorts of things. If it doesn't fit, try to find someone that fits better. And that's something great that came out of COVID is we are less limited in who we can see.
Restriction-wise, yeah. Yeah, it's very true.
If someone's licensed in California and you're seeing someone down the street and you've exhausted everyone in your little pocket of whatever small town you're in, you now have all of California if someone does internet.
Yeah. Yeah, which is, it really opens the door, right? It opens the door to like, okay, there's nobody in my neighborhood, but that's okay. Because I can find somebody trained in this model. This model sounds like it'll work for me. I can find somebody in Nevada and I can, as long as they're licensed, right? Because unfortunately, of course, on the internet, you can also find people who are just like, I woke up today and decided I'm a trauma therapist. And like,
and they're not regulated. We're the only ones regulated.
I once had someone, sadly, who came to me for a consultation. I explained what therapy would entail. They then left, and then they came back like 6 months later, and I said, what happened? And they said, well, you said that you can help me deal with it, but that you can't cure me. But this guy on the internet said he can cure me. So cure sounded better than help me deal, so I went there, which I hear you, but I don't consider what she was coming in for something that's cured. I consider it something that we learn to deal with and that we manage and that we grow around until it isn't pathological anymore. I don't look at it as healing, right?
Well, I want to write that down. Grow around until it's not pathological. That is great.
That's just how I see it, But I'll tell you another really funny story that you'll appreciate as a fellow therapist. I was trained in family therapy, as one of the modalities that I was trained in grad school. And what?
Structural, Bowenian.
All like I had a big family therapy focus, and especially on part of my internship and part of a postdoc training that I did, and I also worked for a family therapist. Like my first job out of school, he was like a real family therapist. I mean, like that was his model. So
Oh, so
when I do, so when I do family mediation now, which is different than well, not so different the way I do it.
Sorry to interrupt. Can you explain what that is in a nutshell? Because I actually am not that clear.
A lot of what I do is I'm working with parents who are struggling to parent a child who is challenging in some way, right? And a lot of times, my way of thinking about it is there's no such thing as a child. Let's bring in the family at some point. So I really like to work with the parents and the child together. I don't like tons of therapeutic secrets. I like the idea, like, you guys can't talk to each other. Let's get you guys talking to each other. Let's fix this relationship, not by, me only hearing out why it's hard for you to communicate with your parents. Let me help you learn to communicate with your parents, and we'll do that together. And sometimes we bring in the rest of the family, especially if it's around something like, again, I don't treat eating disorders. I should say that this is not my specialty. I don't have any postdocs in eating disorders. It's not, other than postdoctoral training in ARFID specifically, I don't consider myself an eating disorder therapist, right? But I will work with disordered eating as part of a larger piece of a teenager who's struggling with a lot of things, right? So sometimes what we'll do is we'll bring in the rest of the family. Let's say everybody in the family is really, is sort of really like looking at this teenager as problematic and needs to control themselves more, and they're eating up all the oxygen in the family and whatever. Let's bring in all of the siblings. Let's all sit down. Let's come up. Maybe we're dealing with someone who's using substances. Maybe we're dealing with someone who has some other form of pathology that's affecting the family a lot. Let's bring everyone into a room. Let's have a conversation as a family, right? That's as close to like family therapy that I'm doing right now. It's not like I'm taking a Bowenian model or whatever, but I'm like family therapy informed in that way.
Yes.
So I had a family come in because I really felt like they were not understanding the approach I was telling their parents to take with their sister, and it was causing problems. So I had them all come in and we had the conversation, and then I was sort of naming the voices in the room, like, you just want her to get over it already, and you feel like a lot of sympathy and empathy for her, and all of a sudden, one of the siblings said, "This is so weird. Are you allowed to do this way?" I said, "What?" So he said, I do internal family systems. I do IFS with my therapist. This feels like you're doing IFS, but with real people in the room. And it was just a funny moment as a therapist, because IFS is based on family therapy, right? Like, family therapy came first. So we were like, aren't you breaking the rules? You can't do IFS with people. I'm like, actually, you can. It's called family therapy. It's a very well-established form of therapy. I'm not saying that in that particular situation we were doing a full family therapy model. We weren't, but we were really letting all the voices in the family air themselves, so that the child who was the primary patient, what we would call the identified patient, wasn't carrying all the pathology of the family on her own. Right? She's the bad one. She's causing problems. She, if she wouldn't have whatever condition she had, then the family wouldn't have to deal with this crisis, versus the one kid who's like, well, obviously because of this, and all right, let's let all the voices, and let's understand how to support her. Right? So that this doesn't become this battle of, Mom, you need to be harder on her. Dad, you need to do this. No, you need to love her. No, you need to this. No, you need to that. You're enabling her. You're not enabling her. Right? Like, we can hear all the voices and be okay.
This is, I love family therapy, and not everybody gets to learn. Like, I just, what you're talking about right now, I'm like, ooh, you just blended them. You made it match
the way, but like, even the way you asked it, I felt like a moment of panic, because I'm like, I'm not really doing structural family. I'm not really doing Bowenian. I'm kind of just pulling and saying, all right. And that's why I call it a mediation session, because like, she's coming home now. You guys will have to figure out how to handle the situation and not make it worse. So can we work on that together? And sure, talk about how you think she's being a drama queen and creating problems for the family. We can hear that, and talk about like, oh, our poor sister who's in so much pain, we should just help her in every way that we can. And talk about let the one who's like, well, I know a great energy healer who could just fix her in 5 minutes, and like, sure, let's talk about it.
Yeah, thank you so much for explaining that, and it was super fun to just listen to. And that's kind of what about therapy. What you did is, no, you didn't do it pure, but you didn't have to. You did it in a way that matched and supported the system, because you were so well trained you could. Yes. And I'm like, I just think that's so delicious as a treatment provider to be able to do that.
Yeah, and I think that does come with a lot of training and a lot of background and a lot of, because you only have to like really rigidly adhere to a model when you're learning the model. You have to tell people if you're not. I think that that's fair if you're doing like IFS informed therapy, but you don't actually have like a level 1 certification. I think people need to know that. If you're like, well, I'm doing whatever informed psychotherapy, sure. I think if someone comes to you for something like, I don't know, cognitive processing therapy, if you're selling cognitive processing therapy, you should be sticking to the model, right?
And we can only know, we don't know what we don't know. And so that is where, sadly, it is up to the consumer, the patient, the client, to ask questions. Because I mean, even what you obviously know your ethics, like you're spot on. Not everybody has been trained well, but I think we're all doing our best.
Yeah, we're all doing our best.
But when it comes to help, it is okay to ask questions. It is okay to say if you're uncomfortable. It is okay to ask, because I was taught when I almost got fired from a job because I went in and I was like, I am in therapy school and I'm going to use those big words. And I sat straight and I used big words. And it was a residential facility. And my mentor at the time said, you need to sound exactly like you do in real life. And I'm like, but I say dumb things and I use swear words all the time.
Right.
It was the nuts, because if you're a different person in here, these eating disorder patients are canaries in the coal mine.
Yeah.
They're going to know that you're being inauthentic because you're presenting.
Yeah.
And so I learned very quickly to just speak like a human being. And it cracks me up when people be like, can you tell me what you're doing therapeutically? Because it just kind of feels like I'm just talking to you. And I'm like, oh, let me break that down.
Yeah. Yeah. Yeah, and as long as you can break that down, right, which is always fun when it's like, well, actually, this comes from here, and this comes from here, and this is why that, and you can do that. When you do supervision, like that's, where they really push you on like, why did you say that at that moment? Like I did live supervision, right? And like, why at that moment did you laugh at the dad's joke but not the teenage daughter's joke? Or why did you lean in when she said that but lean out when he said that, or whatever? You start thinking, why did I do that? And sometimes you did have a theory, like you did, and sometimes you didn't, and it's like they're calling you on something like you notice that you pay more attention to the male voices in the room. Think about that, right? And sometimes it's like, actually, because I thought that joke was a very good way of pointing to something true versus I thought that joke was deflection, right? And I had a reason, and I can sort of, point to the reason. And I feel like anybody, particularly if you're doing eating disorder work, if you haven't done live supervision, do some, right? It's so helpful. Training with someone who you respect is tremendous.
Yeah. Yep.
Yeah, and most of the best eating disorders therapists I've worked with, like I said, when somebody who's in my practice goes from disordered eating to an eating disorder, that's when I have to refer out, because ethically, I don't have the level of training that I would need to feel comfortable treating an actual full-blown eating disorder. You need much more, I feel like, hours of supervised practice than I have, and I don't have the time to pursue that training right now, right? So it's not something I'm going to do. But the best eating disorders therapists that I have ever worked with have thousands of hours of postgraduate training. It doesn't matter what degree they have. If they tell me that I worked in residential and then I did this and then I did a postdoc or then I did postgraduate training, I have 10,000 hours under this person. And I'm like, okay, this is someone I'm comfortable referring to. It goes with like amount of hours of like real training. It takes a tremendous amount of training to be really good at eating disorders.
What's interesting on that too, because I want to make sure to give parents some takeaways, is eating disorders have different ways of treatment. There are people who are in the school of the evidence-based models only. There are people in the school of trauma-informed. I mean, you will get so many passionate directions about which way you should go. And that can be overwhelming and confusing for a parent. So I want to just normalize that.
Okay.
Also wanted to remind parents that there are a lot of myths out there about fault for eating disorders, and even science backs. Don't blame yourself. Families can be the absolute best allies in helping people get better. Now, in that sense, that means that sometimes you do have to learn, and maybe the house needs to be protective of recovery, but like, don't beat yourself up for anything in the past that might have contributed. Look here, look now, look forward, experiment, gather data, and you will find, with proper help, proper professional help, I believe that you will find paths that facilitate change in the direction that you want to go, even when your child has that part of the eating disorder where they don't think anything's wrong.
Right.
They don't want to change. I think that's where it's funny, we're almost wrapping back to this, which we started with, is there's a piece of the eating disorder, the anosognosia, anosognosia, whether we look at it as, wait, is it alexithymia or anosognosia right now? I've just lost I have to say, my brain's a little funky right now, but they don't have an awareness of actually having moved into a disorder. They think that we're being...
Yeah, it's nosognosia, right? Like they have no idea that there's something wrong.
It's actually, I mean, not to have bad humor, but sometimes it's like funny because I have to work so hard to get them to see that maybe something's wrong.
Right. Which almost feels like, when you're a therapist, it almost feels like, I don't want to teach you your pathological, right? But like, honey, the last time you ate was 3 days ago. I'm concerned.
Would you do it to your dog? No. So why to yourself?
Right. Exactly.
So
right. Those are the conundrums of being a therapist, right? Where like, we do have to be the adult voice in the room sometimes of like, no, but this really is dangerous, or this really isn't good for you, or this is coming from a bad place. But we also want to be trauma informed and be very like, this is not a shaming, blaming, me, the therapist in my chair as the big expert telling you what's wrong with you, right? Like that's not what we do.
Right. No, and we're advised to if there's, purging behaviors, because bodies are so different, they can have a response to eating disorder behaviors, from ARFID to, whatever the behaviors are. The frequency, the duration. Some people, their labs get messed up early. Some people, their labs stay great, and then they could have a heart attack. Like, it's so different. So one of the things that's recommended is to see a doctor. But then we go back to the weight bias. We go back to the BMI. We go back to anyone who might have some weight. They actually may need to get sick with an eating disorder to be in the healthy weight range. Right. So there's a whole, it's all...
Wow, I never thought of it that way. That's so fascinating. I'll tell you what this is sparking in me, if it's okay, if we like move into like my own story a little bit, just because this is sparking. You just gave me an insight that's like, wow. So because it goes back to what you said about safety. So I used to exist in a much larger body than I exist in now. Some of that had to do with like hormones around childbirth. It had to do with a lot of different things, real lack of knowledge about nutrition. But at one point I was very, 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 very unhealthily, like in a very large body, I guess. And I was pregnant. And I went to my doctor.
What? Like when you say unhealthy, did you actually feel bad? Were your labs bad?
Yeah, no, my labs were not good. I was, hearing that I had a fatty liver, like all the stuff. And I was getting warned that this was bad for my pregnancy. And I was pregnant, and I went to the doctor, and I said to the doctor, I'm really not feeling well. Like I can't breathe, and I just feel much more exhausted. I don't even know. I can't get through the day. And the doctor said, well, you are this and this and this amount overweight, and you're like pregnant, and but I can't tell if you're morbidly obese yet or not, because like he's giving like all this, like, because I don't know how much is the baby and how much is you, but what do you think? Of course you're going to be exhausted and feel like you can't get through your day. And like I didn't persist because I felt so shamed, even though
I was like, blame.
Yeah, even though I was a PhD student, I'm capable of advocating for myself. But in that moment, I was just like, yeah, that's me. I'm a failure. I'm doing a bad thing to my kid. This is terrible. And like I left. Turns out I had walking pneumonia. And And I had it for months, and I only found out when I delivered the baby, and then they discovered that I had pneumonia because I had fever, and then my lung collapsed. It was just bad. And that's when they realized. I had walked around with walking pneumonia for months, but I never went back to the doctor and said, no, I know I'm a grad student who's pregnant, who already has small children, and I'm overweight, but there is something more wrong with me than that. Do something. Right? Yes. I didn't advocate for myself because of that disempowerment of like, and it's so interesting because remember when I told you at the beginning that there was a time that I was running like a CBT for weight loss group? That was after I had really reclaimed my health and started really working on it in therapy and by myself. And now I'm just realizing as I'm talking to you how much of that was about me restoring my sense of safety. Like I will never be in that position again where a doctor can dismiss me and I collude with him. Like I'll never let myself be there again. Oh, right. And yes, for a while that meant getting very restrictive about reclaiming my health. And some of that was, those were in the years that like Biggest Loser was like the #1 show in America and, all that kind of stuff. So I really did buy into like, I've got to do this. Like I could have killed my baby. Like my thought was I could have killed my baby, right? This is terrible. I didn't give my baby enough oxygen. How could I do that? Like how, forget me. And I didn't have oxygen, which is also not optional, right? Because I wasn't even thinking that way, right? You right away go to, I'm the worst mom in the world.
Right. Because you went there. Like, but what does that say about you? It says how thoughtful, considerate, like you put your baby, like just leaning into accepting that is so beautiful about you.
Yeah. And I think that some of the way I thought about like losing that weight was very rigid and very terrified.
Yes.
Right?
Yes. And I really heard Biggest Loser. I don't know if you watched the documentary, but it's pretty enlightening.
Yeah.
And to get there, to avoid the shaming, you probably put yourself through things that ultimately were not healthy and did not enhance your life.
Yeah. A lot of them didn't until what I figured out for me, and this goes also to because I was raised as somebody with like complex PTSD as a small child in a home with a lot of medical needs. I used to feel very selfish whenever I engaged in any self-care at all. It was like, how dare you? But I had this little back door, which was you have to eat. You're allowed to eat. So eating for me it wasn't about emotional eating. It was not about like using food to soothe my body. It was, I need to take a break. And this is a socially acceptable reason to take a break if I eat. Right?
It was like your smoke break.
Yeah, it was my smoke break. Exactly. So the first bowl of pasta was lunch, but the second bowl of pasta was, well, I don't want to get up and start working again. I got to eat. Right?
I have a theory about that. Often when people get bored, they don't know how to sit and deal with being bored or stillness. And so they fill it with doing, which is eating.
Yeah.
Fascinating.
Yeah. For me, it was, no, I was never bored. It was the opposite. It was like I desperately needed to just take a break. Not because I want to eat something, but because I just want to sit down and, I don't know, stare out the window.
It gives an excuse for stillness, whatever the reason. I so understand that. And I just, so empowering for you to see that piece, because once you see it, accept it, you have a choice about it.
Yeah.
But until then, you're just white knuckling the second pasta.
Yeah, exactly. And I think then when I figured out how much of it was tied to my trauma, I wanted to give other people an ability to reclaim their body from trauma. Because the problem with trauma and your body is your body's either very, very right or very, very wrong when you have PTSD. You're either having a panic attack because there really is something scary going on, or because your body decided something reminds it of something that happened a long time ago and you're having a panic attack. So when I would hear like about intuitive eating, trust your body, like my body is not trustworthy. Like I can't trust my body. It never tells me the truth, right? So what worked for me was when I was totally able to separate the act of giving my body nutrition from anything emotional, from anything like, in other words, like I remember being struck by like a friend of mine saying, my scale's not giving me any love right now. Being like, scales are inanimate objects. They can't give you love. If you're looking for love in a scale, something's wrong, right?
Yep.
Like you're conflating two things, right?
Yeah.
Or, if I need to eat in order to take a break, so the way I did it, and again, it goes with my personality of like, I will never be unsafe again. This will never happen to me again. Mechanistic eating worked for me, right? Because I didn't want to think about food. I wanted someone else who is smarter than me in this topic to say, these are the foods you need to eat during the day because these are the nutrients you need. Just do it. Right?
And you could, yes, and then you could actually give yourself what you needed.
Yeah.
Without all the confusion. And eventually, tell me if I'm wrong, but eventually you clued in more to what your body wanted and needed.
Totally. I don't eat mechanistically at all anymore. I really eat intuitively. I eat the foods that my body needs. I now know when I'm hungry for protein. Do you know what I mean? And like things like that.
When I was coming out of the eating disorder, my first craving, I was so pissed. Sorry if I'm not allowed to swear, but I was so mad because my very first time I could actually hear my food my body want something, I was like, spinach? What the hell? Spinach?
Yeah.
I had anemia.
Yeah. You had anemia. Yeah.
And I was like, wow, you mean your body tells you what you like? It almost made my mind explode. But same with you, you know, the paths. I believe in evidence-based. I believe in manualized treatments. I believe in eclectic. I believe in what you did with the family therapy. I know a few modalities, not as an expert, but I know them well enough where if I need to shift, you know what I mean? I can combine them, shift around.
Right.
Because people are going to be different. And where I'm going with this is getting to the more neutral space is often a space, and we were going to talk about body appreciation, body neutrality today, and we basically are, because sometimes just getting to a neutral space. When I was dealing with being a woman, aging, having an eating disorder in the past, now just being a woman in society, I never thought that I'd be like someone on social media going, I love my body. It was never going to happen. I was never going to hug myself and wear lingerie and no.
Okay.
So I focused a lot on more of a body neutral stance. And you're talking about more of a food neutral, like you had to get to a neutral path before you could get to intuitive. Yeah. There's no wrong and no right. There's just what works out of all the options. What gets you where is truly in your best interest, not your eating disorders, not your disordered eatings, not your shame of your doctor's best interest, but truly your best interest. And that may change as you go, because your first best interest was protecting yourself from another doctor saying something jerky like that.
Yeah. Yeah. Or myself feeling disempowered to advocate for myself. Like that was messed up. Like I'm not shy in that way. I advocate for myself. But in that moment, I didn't have the ability to like, it was just like, yep, I'm fat. Yep. Okay.
Oh, when you were drowning, there's a fabulous study that so many people do not tell their therapists about their eating or body image issues because of shame.
Yeah.
They will tell anxiety, they will tell depression, and sometimes it's actually caused by the food and the irregularities and the purging or whatever else is going on. But I cannot imagine how many therapists and clients feel like therapy failed them because there was too much shame, risk to even admit it.
Yeah.
So back to the body neutrality pieces, you did it with food, you finally got intuitive. Regarding bodies, I just learned to really quietly thank my body, because this was back when body positivity was like the rage, and that was, you had no options. You could either dislike your body or you could absolutely love it. Roll with love. And I was like, dude, that is just not happening with me. And I appreciate my body so much. I appreciate what it has done for me. I appreciate what I've put it through. It keeps repairing itself. This will all heal. I did nothing permanent. It's so interesting to get to that functional body appreciation. This is for anyone who feels like I am never going to love my body. That is okay.
Yeah.
It is okay. And life might feel even better with more body appreciation. The thighs. I hear so many people say, I hate my thighs. And I'm like, really? Because your thighs let you sit down and stand up 3 times in this hour.
Exactly.
Your thighs let you walk over, bend down, pick up your baby. And your arms that you don't like held your baby close.
Yeah. And I think there's so much truth. And I think there's also sometimes when it gets very stark, like you're either bought into diet culture or you're bought into like body positivity, let's say, and neither feels resonant to someone who's coming into therapy. it can feel very off-putting, because that very performative body positivity can sometimes feel a little like narcissistic or performative to somebody who's like, and like what you're saying is, well, there's a place in the center of that seesaw of body acceptance, body neutrality, saying like, this is the body that functionally does the things I want it to do. And it doesn't mean like we're holding out until you're at the stage of like, celebrate my body in all its ways, like, then you're not fully healthy,
Right. And body positivity started as a social justice movement, and then
Right.
it just seemed to kind of morph into this social media type presentation.
Right.
So it's had its own evolution. But I guess the point is, even as you were talking about your mechanistic eating, don't worry for listeners. Please know that between the black and white is so many shades of gray, are so many colors, are so many options, and they're not wrong or right. If you're a parent and you're listening to this, I already know you have resilience. Just keep finding new ways to try, because there is a more full life out there.
Right.
For you,
Right.
for your kids,
Yeah.
whatever's going on.
And I think that's the point, right? There was probably a time in your life when you woke up every morning and the first thing you thought about is, do I like how my body looks today? And you went to bed thinking, do I like how my body looks today? And now having that body neutrality of, it's my body, right? It's not the front and center thought. You don't wake up and the first thought is, how does my body look? The way I was able to sort of wake up and not think, am I going to eat today? Shame, shame, shame. Or am I going to not eat today? That's good, right? Like, that's not a way to think, right? To just being like, first it was like, I'm going to just eat the foods that are already in my fridge, and I'm not going to think about it again because I don't want to devote another second's thought to this, which took it away from being centered in my psyche as something I have to think about. And now it's also not something I have to think about, which is crazy because like that just happened.
Me too. I used to actually take my college roommates' cereal. There was a particular cereal, and I would chow the entire thing and then have to go to the store, buy them a new box, and replace it due to shame. And now it sits in my cupboard and goes stale because I forget it's there.
Right. Because you're not even thinking about it.
Nope. Food can lose its power.
Yeah, it can really lose its power.
And that's anywhere from disordered to just a little bit troubled, all the way to eating disorder. I truly believe that it can lose its power. It's not an easy journey for many, but it's a worthy journey.
Yeah, it's a very worthy journey. And for any parent out there, your kid, right now you might be in the thick of it, right? Of like, you're listening to this episode because your kid was just diagnosed, or your kid is coming out of residential treatment, or you're feeling all this shame and guilt because, like, I had one parent in the post-traumatic parenting community that's feeling very trepidatious, I guess is the word, about going to the family sessions at her kid's eating disorder residential. And she just feels like that brands her as the worst mother in the world, that she's, I guess, a mom going to her daughter's residential treatment center, and like so much fear about even just going in, which totally get it. I hope they're gentle with her. I can't say I'm sure they will be, but I can say that if they're professionals, they will be. That's their ethical obligation to be, right? She's not there to hear what a bad mom she is. That's not what those groups are about. But this idea that one day your kid it is possible, your kid can become that person where food's just like the thing I eat sometimes, right? Like, that's it. It's not anything more. It's not anything less. That can be the outcome. The outcome doesn't have to be this like hugely enthusiastic body positivity, and the outcome doesn't have to be, whatever, a bodybuilder, right? The outcome can just be food. It's just a thing.
Yes, and life full.
Yeah.
Yes. And to that mom who is thinking that, after working with as many parents as I've worked with and running multi-family groups and having my own support group, I can nearly bet money, which I know we shouldn't do, when we wouldn't do because it crosses boundaries, but I'm just going to metaphorically say it, that at least a few other moms are thinking the exact same thing that show up and want to hide.
Yeah. Yeah. And it's so helpful when you're with other people who get it without words, right? When it's like a real, oh yeah, me too. Yep. Yeah. I've done that. I've, found the, laxatives in the bathroom or whatever the, particular thing is. Yep. Me too. I know that feeling. Right.
Yeah, I actually kind of don't like my kid right now, and I feel ashamed
Yeah.
of it. You don't like yours either right now? I
Yeah.
love him, but this is hard.
Yeah.
Yeah, not alone.
Yeah. Yeah. And that ultimately is one of the highest forms of healing, right? Is when we realize we're not alone. Like we're in this together. We're like there other people have gone through it, maybe with their own little flavor, but other people have gone through it too. Right?
And thank you for podcasts like this because even in what we were talking about, like I feel that sense of so much more connectedness, even though we were
Yeah.
already friends. Like
Yeah.
I really know I'm not alone.
Yeah.
You get it.
Yeah. Yeah. And you get it, right? I had a lot of fear of telling you like the time that I was leading those like CBT for weight loss groups because I was like, Allie's going to be like, you should never, you bought into diet culture, right? And you were like, I get it. I get where that was coming from for you.
Yeah.
Which I think for all of us, the fact is like we are more similar as humans than we are different. I think that's just a message that the world needs to hear. Like, you know, looking at like the post-traumatic parenting community, like we are from all walks of life and from all corners of the world. And like, it's kind of sad, but having a really difficult childhood or a really difficult entry into parenthood that you need to recover from because it was traumatic is kind of universal. You know, we're just more similar in suffering with being human than we are different.
And yes, and even when you feel like somebody is not doing their best, they might be
Yeah.
because we are so much more similar, but not everybody has the same development, the same skills, the same safety, the same bravery, the same, we're similar. And then there's also, I don't, I meant to actually echo you on that, but what I really mean is, I think the intention most of the time is truly not to harm, is to do
Yeah.
their best, and is to connect.
Yeah.
And when things get in the way, it's just because things get in the way.
Yeah. Yeah. I could even think of like the people who attacked me online when I did that group were people who were looking at the harm that that type of an approach can cause. Like I'm a clinician. I've seen patients have real harm with this kind of thing. We shouldn't be talking about diets at all. They have a point, right? That's based on their experience and what they've seen their patients go through. And, you know, it's not bad. I think it's better to start a dialogue by actually calling the person than like calling them out online. But, you know, that's the culture and world we live in.
That is true. That is the culture. But also, again, we're going back to the rigidity thing, which is, and I avoid most absolutisms, but
Hmm.
anything that is black and white, is it really?
Yeah.
That's scary to me. To me,
Yeah.
that says maybe someone's too scared to look in the middle.
Yeah. Yeah. A friend of mine who's a really great marriage therapist always says that about like my wife triggered me and like there's like this assumption now of like she triggered me, it's a problem, we need to take the trigger away. She says like from the much younger couples that are coming into therapy now, as opposed to that triggered me, I'm so curious about that.
Oh my gosh. Robin, we could talk for days and days. This whole like social media has been amazing at taking away a lot of the shame of mental health. I really like
Yeah.
I'm so grateful for it.
Yes,
And in
me
some
too.
ways it has made it's just
Yeah.
for the audios who's not looking, I look absolutely exhausted. My eyes are
Yeah.
about to roll.
Yes.
The it's like guys, being triggered being uncomfortable is growth.
Yeah.
We
Exactly.
can't avoid being uncomfortable unless you want to keep be growing in intolerance of discomfort, which makes life so hard.
Yeah. Yeah. Which is so true. And it's so, you know, it's nice to have safe spaces, but safe spaces should be for the moments we need safe spaces. We don't always need safe spaces, right? And
Yes.
there's that. I mean, I had this startling experience once where I changed my hairstyle at one point, and somebody met me in real life, someone who follows me on social media, and she said, "Is this your new hairstyle?" And I said, "Sometimes, you know." And she said, "Well, it reminds me way too much of a teacher who harmed me. If you're going to keep wearing your hair like that, I have to unfollow you on Instagram." And it was just like, that's your choice, But where have we come, and I'm not judging her, but we've come to a place in society where somebody can walk over to a relative stranger that she has a parasocial relationship with, right? So I'm like admitting that in a way I invite that because like I'm online, I talk to my followers, I have a social media community and whatever, but like, and demand that they change an aspect of themselves that makes you uncomfortable, right? There's something there that, you know, and I said, I want you to invite that discomfort in and think about this because clearly I'm not that teacher, right? I may look like her. But, you know, I mean, lots of people have brown hair and brown eyes. And I was wearing my bangs down across my forehead. I think that was the, you know, and wear bangs across their forehead and their hair in a ponytail. I mean, like a lot of people dress like that. You know, like there's something to be said for, you know, for a moment I was so startled.
I bet.
You know, but then it was like, I like, this is interesting because I don't think that's what we meant when we meant trigger warnings and safe spaces and things like that. I think it was more for like, go into therapy and talk to your therapist. I say this with full respect. I'm not saying this in that dismissive, like, go to therapy. I'm saying it in a, go into therapy and say to your therapist, this is so odd. I've been following this person for a long time. And then I saw her in real life and she was wearing a hairstyle and an outfit reminiscent of my high school teacher. And suddenly I felt like I never want to read her book or look at her stuff or listen to her ever again. Help me understand that. Right? Because that's disproportionate. And also, like you're saying, black and white is an indicator of like a pink flag. So is disproportion.
Yeah, and that's kind of where we are landing a little more in society than maybe we haven't been. But hopefully the pendulum will have our growth from whatever's going on now, and hopefully we'll swing in another direction. I don't know what direction it'll be.
Right.
But
hopefully letting other humans be human and respecting that and being like, this is so cool. We are so alike and yet so different and yet so alike. And this is so lovely. Like, maybe we'll get there.
I hope so. I hope before I exit this earth. I hope.
Yeah, I hope. We can just fight that good fight. All right.
One more thing to any parents listening. If you are worried your kid has an eating disorder, obviously the medical piece, it is just something to say out loud. The National Eating Disorders Association has something called a parent toolkit that will talk about different labs because it's not always the standard labs, and the doctors are not always. Usually we have to pursue eating disorder training, and that is dietitians, doctors, therapists. Like you actually have to pursue it.
You have to specialize,
yeah. Automatically come. So they may or may not know about it, but you've got the Academy for Eating Disorders that has a medical management brochure, and then you've got the National Eating Disorders Association that has the parent toolkit. They also have a wonderful sheet for vetting, for asking questions of potential providers. And it gives you, rather than you having to rack your brain about what to ask for a potential provider, whether it's nutritionist, dietitian, doctor, whatever you're going to start with, it really can be quite helpful. And I cannot believe I just noticed that adorable doll right behind you, Robin. I want to hug it.
No way. Yeah.
So that, parents, I just need to give you that piece because that is, there could be, we don't know with the frequency, the severity, all of that stuff, but because this is a psychological illness with potentially physical, medical issues, the medical is usually the first thing that, as Robin said at the very beginning of this, we think crisis and safety. Let's organize the buckets, crisis and safety.
Yeah, we can't come back from dead, so let's start with that, and then we'll move on.
Sorry to laugh, but it was good.
I know. It's just because this. I feel like this is something that I say to beginning clinicians all the time. Like, first let's establish safety, then let's do everything else.
Yep. This was awesome. Thank you so much.
All right. Thank you so much. Thanks so much for coming on. And like I said, when your book is coming out, we'll have you again and we'll do some like promos. It's such a good book. I feel so honored that I got to read it early.
I'm here on social media to be descriptive, not prescriptive. I'm here to educate, inform, and hopefully entertain, but never to treat. If listening to this podcast helps you realize that you need therapy, I am all for that. But podcasts aren't therapy. Please reach out to a mental health professional licensed in your jurisdiction. You'll be glad you did. Wish Post-Traumatic Parenting was a talk show, not a podcast? You have a question for me or for my guests? Great news. You can ask those questions by following me on Instagram. My handle is @DrKoslowitz Psychology. It's also in the show notes. I love it when people reach out, DM, or post a question. Who knows, your question might spark an entire episode. Come join our community. We get it. We're post-traumatic parents too. Can't wait to hear from you.